I'm going to start this course with some of the basics. These are some staggering figures that you need to consider just in case you are wondering why we are even concerning ourselves with this topic. After all, older people don't die by suicide, do they? I mean, sure, probably some do. Most suicides are carried out by young people, aren't they? And you are also probably asking yourself, what am I supposed to do about it anyway? Is there a role for me in suicide prevention? The short answer is, you bet. Suicide can be prevented. To begin with, the highest suicide rates have historically been among the oldest Americans. According to the Population Reference Bureau, many elderly have undiagnosed or untreated depression, which can be intensified by the trauma of losing a spouse or the stress of living with a chronic illness. Elderly adults often lack frequent social interactions that can help protect them against the loneliness that can exacerbate depression. Compared with suicide attempts among younger people, suicides among older adults tend to be carefully planned and more likely to be completed. Also, many elderly have underlying health conditions, which reduces their chances of surviving a suicide attempt compared with younger adults. In order that we are on the same page, let's start with some definitions used by the National Institute of Mental Health. Suicide is defined as death caused by self-directed, injurious behavior, with the intent to die as a result of the behavior. A suicide attempt might not result in injury. Suicide ideation refers to thinking about, considering, or planning suicide. A look at the demographics for 2020. Among females, the suicide rate was highest for those aged 45 to 64, 7.9 suicides per 100,000. Among males, the suicide rate was highest for those aged 75 and older, 40.5 suicides per 100,000. In 2020, firearms were the most common method used in suicide deaths in the United States, accounting for over half of all suicide deaths. Among females, the most common methods of suicide, 33%, were from firearms. Next was suffocation at 29.1%, and then poisoning at 28.6%. Among males, the most common methods of suicide were firearms at 57.9%, followed by suffocation at 26.7%. The number of suicide deaths was on a downward trend in the years 2019 and 2020. However, the CDC reported an increase by 5% in 2021, and then a further increase by 2.6% in 2022 to almost 50,000 Americans, the same number of people who fit in Dodger Stadium. The Surgeon General of the United States, Dr. Vivek Murthy, said, "Mental health has become the defining public health and societal challenge of our time. Far too many people and their families are suffering and feeling alone." He went on to say, "These numbers are a sobering reminder of how urgent it is that we further expand access to mental health care, address the root causes of mental health struggles, and recognize the importance of checking on and supporting one another." Adults 65 and older saw the largest increase in suicide deaths of any age group from 2021 to 2022, with an 8.1% rise to 10,433 deaths by suicide in that year. As you can see, we are talking about a very serious problem. In 2021, 48,183 people died by suicide in the United States. That's one death every 11 minutes. But even more people think about suicide or attempt suicide. 12.3 million people seriously thought about suicide. 3.5 million made a plan for suicide. And 1.7 million people attempted suicide. According to the CDC, suicide and suicide attempts cause serious emotional, physical, and economic impacts. People who attempt suicide and survive may experience serious injuries that can have long-term effects on their health. They may also experience depression and other mental health concerns. Suicide affects us all. In fact, There is research by Dr. Julie Serrell at the University of Kentucky that says on average for every one suicide, 135 people are affected. We may not even be aware of it, but suicide and suicide attempts affect the health and well-being of friends, loved ones, co-workers, and the communities in which we live. When people die by suicide, their surviving family and friends may experience prolonged grief, shock, anger, guilt, symptoms of depression or anxiety, and even thoughts of suicide themselves. And there is something else to consider. There is a huge financial toll that suicide costs families and our nation. Just look at the year 2020. In that year alone, suicide and non-fatal self-harm cost the United States over $500 billion in medical costs, work loss costs, value of statistical life, and the quality of life costs. Suicide can be prevented when everyone takes a role to save lives. The CDC has suggested strategies designed to support people at increased risks to a focus on the whole population, regardless of risk. It's worth a look at their strategies and see where you might have a role in some of them in your community. It's also useful to see which areas they feel are important for the mental health and welfare of all members of our communities. Strengthen economic supports. Improve household financial security. Stabilize housing. Create productive environments. Reduce access to lethal means among persons at risk of suicide. Create healthy organizational policies and culture. Reduce substance use through community-based policies and practices. Improve access and delivery of suicide care. Cover mental health conditions in health insurance policies. Increase provider availability in underserved areas. Provide rapid and remote access to help. Create safer suicide care through systems change. Promote healthy connections. Promote healthy peer norms. Engage community members in shared activities. Teach coping and problem-solving skills. Support social, emotional learning programs. Teach parenting skills to improve family relationships. Support resilience through education. Identify and support people at risk. Train gatekeepers. Respond to crisis. Plan for safety and follow-up after an attempt. Provide therapeutic approaches. Lessen harms and prevent future risk. Intervene after a suicide, postvention. Report and message about suicide safely. Okay, this was the introduction to the issue. We are going to delve more deeply into some of the issues that relate to suicide. Issues such as isolation, mental health, substance abuse, and others need to be addressed in order to understand the cause and possible pathways to solutions that you can employ to prevent suicide in your work with the elderly.